All right. Ooh, that was so fast. So we are live. Happy Trendy Tuesday, everyone. It's been a while, but I'm happy to be back. As always, I am joined by the lovely Dr. Sophia Yen, the CEO and co-founder of Pandia Health. She's also a doctor herself, which is perfect for tonight's topic, which is how to choose a good healthcare provider. There's so many good healthcare providers out there. That doesn't necessarily mean they're all right for you and what you need. So we're kind of going to delve into all of that. But before we do that, just a couple reminders. Follow us on all of our social media at Pandia Health. We post pretty much daily on all of our handles. So check that out. And if you have any questions or anything, feel free to leave us a comment below and we'll have someone get back to you either during or right after the live. So feel free to chat with us. We're always happy to answer questions. No dumb questions or nothing too much, like no filter on here. So yeah, without further ado, that actually brings us into tonight's topic, which is finding a healthcare provider. I actually think this is great for people who are my age, just graduating from college and transitioning into maybe a new state or a new just like life time in our lives where we don't necessarily have a doctor that our parents had. And I know for me, I was thinking like, oh my God, what am I going to do now? It comes to that annual visit. And I'm like, wait, I can't go back to Connecticut. I don't know what I'm going to do. So it kind of brings us into our first question with how should you go about switching healthcare providers or just finding a new one altogether when you're kind of in that transition time?
Yeah, so exactly as you mentioned, right? When you're graduating college or if you're heading off to college, those are, two obvious breaks, or if you're moving cities or states or countries. The way I think it depends on what you're looking for. If you want the most touchy-feely, will spend time with you kind of doctor, usually family medicine. But if it were me, I want not necessarily the one with the nicest touchy-feely, but the one that if I have some weird disease, I'm like, and they'll like find it and they'll take care of it. And so there's obviously a balance. So if you want to get the most, sharpest, smartest doctor possible, may not be touchy-feely, but may look to see where did they go to medical school? Where did they go to residency? Did they do a fellowship? And in general, if you don't recognize the medical school or residency, probably not a good one, though the exception I give is the medical school I went to, which is UC San Francisco. So University of California, San Francisco, I think is one of the top 2 or 3 medical schools in the United States and therefore the world. Number 1 being Harvard. So you all should recognize Harvard. And then UC San Francisco. For those of you not in medicine, you may not recognize like Hopkins. That might be the other one that you've never heard of. But the other colleges are your standard colleges that you would have heard of. Stanford or, Georgetown or any of the UCs or Brown or Yale, etc.
That's a good med school.
Yes, GW does. And so that would be my advice in terms of choosing the best, trained one. And then the other thing is like for your general provider, do you want internal medicine? Do you want family medicine? Internal medicine I like because they study from 18 until death. Family medicine is from birth until death. They can do surgery and they can deliver babies. So to me, that's cool if you're in the middle of nowhere and you only have one doctor and they need to do everything, or if you're to go into Africa or some other country where they need you to be able to do anything, anytime. But for me also as a doctor, I know that's a lot of information to know and cover and to keep up to date on. And so if you see a person who only does 18 till death, they may be like, oh, I don't know this. I need to refer you to a specialist, refer you to a specialist, refer you to a specialist. Whereas a person who thinks they know everything is like, I can handle this. I can handle this. I can handle this. And so it's just a question of that. And then every doctor is different. So maybe the, internal medicine place in your place does everything and doesn't refer out, but maybe they're the type that refers out and it may just be doctor to doctor dependent. It may be regional, etc. Family medicine in general tries to handle everything, but maybe there's a family medicine that sends everything out, etc. So there's that consideration. Asking your friends who they use and if they like them, that's the more touchy-feely, because I wouldn't think your friends would know how to evaluate on the medical level what the doctor is. And as a doctor, I've actually not used the other doctors. I've seen them in class and see them answer questions, and I've referred people to them. But mainly I just look at the resume and be like, do I recognize this school or do I not? And if I do, then we're good. And if I don't, that's when you have to like do a little bit of digging. So that's how you could go about picking your doctors.
Cool. Yeah, no, that's really helpful. I know it's super overwhelming too when you move to a new place and you're thinking of everything else but getting a doctor, but you don't necessarily want to wait until the last point where you're actually sick and you're like, oh no, I actually don't have the doctor, because you don't necessarily want to go to the emergency room right away, which you can, but it's not ideal. So it's always
go wherever you need to go. But yeah, urgent care, just money saving wise, and also exposure, right? If you walk into a normal clinic, not so much exposure. If you go into the ER, you're exposed to everything and anything. And the key thing I think people don't realize about the ER, if you've never been in the ER, it's not first come, first serve. It's who's going to die first. So if you're coming in for some small thing that's not going to die right now, and 10 people come in with gunshot wounds, they're going to go first, and then you're going to be pushed off 3 hours later. But of course, if it were you trying to die of a gunshot, you would want to be prioritized. Right. So just, know that's the way the ER works. Whereas if you're going for regular care, it's you schedule an appointment, you get seen, and so.
Exactly. Yeah, no, that totally makes sense. And you kind of mentioned this a little bit, but how do you feel about choosing a primary care provider versus just specialists? Do you think you should have both? Do you think maybe in a certain stage of life you just need the specialist? What are your thoughts on that? I'm always curious what the idea is there.
Yeah, no, I think the difference between a primary care provider and a specialist is the primary care provider is often the glue that brings it all together. And the example I give is polycystic ovarian syndrome. As an adolescent medicine specialist, it's interesting because I'm both a primary care and a specialist. So I can consult on the pediatrician how to take care of the teenager, consult in internal medicine how to take care of the young adult. But I can also just be your pediatrician, internal medicine kind of person. And that's very rare, and it's confusing for insurance, and they don't know how to bill. But with respect to PCOS, if I send you to a gynecologist, they often will prescribe birth control and hormones because that's what they know. If I send you to an endocrinologist, they will prescribe you metformin because they know about diabetes, and they're less so about birth control pills, though certainly they can prescribe that as well. But as your primary care physician, it's my job to take the recommendations of the specialist and decide which is better to put it together. And the research has actually shown, rather than just metformin or just birth control, if you put the two together, it works better. And if you just saw the gynecologist, you'd only get this. And if you just saw the endocrinologist, you'd only get this. But knowing the primary care doctor, we're like, what's the evidence? And then what if we bring it together? It's kind of like peanut butter and chocolate. So you bring it together, and that's the example of primary care. The other thing with the primary care is that they are seeing you, like I like to say, 18 until you die. And so they know you. The specialist, you are not allowed to do that in the healthcare system. You will only get to see them a couple times, or if you pay for it, you can see them as many times as you want, but that's going to cost you crazy money, and you may not need that level of care. And another example I give there is acne. 85% of acne should be able to be handled by your primary care physician. So it could be your pediatrician, could be your internal medicine doctor, could be your family practice doctor, and only for Accutane or worse do you really need to see the dermatologist. And the thing in medicine is they want us to work at the top of our license. Like if you're a dermatologist, doing acne is like meh, but like doing really ugly, severe, painful acne, yes, or doing skin cancer or, stuff like that. Same thing with like birth control. For a gynecologist, that's nothing. Leave that to the primary care, or leave that to the online services, or take that over the counter. Much rather be delivering babies, doing surgery, doing cancer, that kind of stuff, than just stuff that should be over the counter and easily done, or the pharmacist can do it. There's just so many work at the top of your level rather than something that could be handled by somebody less, and save the, specialists for that special kind of situation. So gynecology is a exception to that, because like for pap smear, they specifically made under the Affordable Care Act that you can go to a gynecologist, you don't need a referral, or you can go to your primary. And it's because a lot of the primaries can do it, but the insurance system's set up that I don't get paid as much as if the gynecologist does it. And the gynecologist does a ton of them, so they're set up to do it really, really quick. Whereas if you're internal medicine, and I had one that could do it really quick, but some offices only do like one a week or one every 2 weeks. It's like, oh my gosh, where's the equipment? How do we set it up? It's like slow and just messes up my clinic. Whereas the gyne clinic's always like, take off all your clothes, spread them, Whereas internal medicine doesn't spread them, spreads them sometimes.
That totally makes sense. And that makes sense specifically with the gynecology too, because I know I would feel better in that case because I feel like in a lot of situations, the gyno, they just know so much and they're so used to seeing that. Whereas like with someone who's in internal medicine, they're seeing everything, which is great, but they're maybe they've only done one recently. So I would rather go to someone who's done more. But that's really interesting about specialists in general, how you can't see them as much. I didn't know that. But it makes sense because they're always super expensive and they take forever to get in.
Yes.
Which is really interesting. Whereas like with the PCP, usually there's more appointments, but with the specialists, it's like, oh, we can see you in 2 months. It's like,
and there's actually far fewer. And the example is like, we graduated medical school at UCSF, and I think it was like 140 per class. But out of that class, only 2 plastic surgeons. So like there just isn't the same number, obviously, as primary care. And then the flip side is a lot of people think their specialist is their primary care. And for some people, it's because they see their specialist so much as a cancer patient, like particularly pediatric cancer. They see them like every single month, you know, but it's like they're cancer. They're not primary care. They're not up on your shots. They don't know how to counsel you on vaping or, you know, other stuff like that. And the gynecologist tries to do primary care, but again, you're a gynecologist. You didn't study the cholesterol and the, you know, diabetes and stuff like that, you know. So don't let the specialist be your primary care doctor. For your annual checkup of general health, diabetes, cholesterol, heart, you know, that kind of stuff. Maybe not the gynecologist, even though they can do some of it, but you know.
Right, exactly. Like they're great at the gyno stuff. Maybe check in with someone else. And I've learned too that you can always call your doctor even and leave them a message, and either they'll get back to you or a nurse will get back to you. So even if you're thinking maybe I don't necessarily have to go in, but I have a question, it's always good to just call. And even if they don't get back to you right away, I would still feel better doing that than just right away going to Google. Yes, you'll get an answer immediately, but it probably won't be the right answer, or it'll jump to conclusions that
it will scare you.
Right. Every time. It's like, really? But that's just what happens. So definitely important to have some type of medical figure and someone, as you mentioned, who has studied and, you know, didn't necessarily get I don't really know how you would get a bad degree in medicine. Are there bad medical schools? I don't know.
The joke in medicine is, what do you call the person who graduated last in their class from the worst possible medical school?
The doctor.
Yeah. And most people don't know to ask, where did you go to medical school? And certainly you don't ask where we ranked. And I don't think that matters as much per se, right? Because maybe the worst person at UCSF would have been much better than the best person at some college you've never heard of, you know, something like that. I don't think there's any bad physicians, but there are some weird loopholes out there where they didn't necessarily have to do residency. So I would absolutely make sure they completed residency. I think they are required to complete residency to practice medicine in any of the states in the United States, but I could be wrong, but I'm pretty sure you have to, because my uncle came from Taiwan, and even though he'd been the head of a hospital in Taiwan, they made him redo his residency in order to practice medicine. And I was like, this is 20 years after you did residency, and residency is horrible. You have to pull an all-nighter every fourth night for 3 years. And to do that at his age, you know, to practice medicine in the United States is horrible. So he found a way around that where he did a fellowship in the United States, but still he had to do something.
Right. Okay, I didn't know that, but that's crazy. And then this actually reminds me, a little bit unrelated. How about DOs? How are they a little bit different?
So what's interesting about the DOs is they go to a different school that has, I think, like spinal manipulation and more kind of stuff that we don't call standard Western medicine per se, but they do the same residency. So the good news is they finish off the same, and you could ask them what residency you went to. And if it's, you know, this MD went to Children's Oakland and this DO went to Children's Oakland, and they finished that last 3 years of training at the same kind of level and the same sort of requirements. There are people that don't get through residency because we're like, no, you don't. You know, it's rare, but it absolutely happens.
I like that.
And we take the boards. So that is a horrific exam at the end. It's like 3 to 8 hours, like an SAT on steroids. And then we used to be required to retake that test every 5 to 10 years. And luckily now they have a continuing education thing, which I think is better, where you continually educate and get quizzed as opposed to just cram for that one test and then do or die.
That's crazy. Okay, that makes a lot of sense. But wow, yeah, medical school is intense. But I'm glad you're explaining everything. If someone wants to go to medical school, it's very informative. So the last question that's specific to kind of our practice at Pandia Health, if you actually want to go ahead and get a pap smear, is that something that is, number one, covered by your insurance? And number two, is that something you think you should go to the gyno for or your PCP? And kind of why do you need to get a pap smear? We'll cover all of that.
Yes. So number one, thank you, former President Obama, current President Biden, for passing the Affordable Care Act and for all the people that voted for it. All the people that voted against it, but for the people who voted for it, yay, thank you. Because under that, the well woman visit, which is an annual checkup and a pap smear as necessary, and or a visit to the gynecologist for same, are covered with no copay, no deductible. And I haven't heard of any religious employer trying to fight that. So that's awesome. The pap smear is where we put in a speculum and we go for the we go in the vagina and we go to the cervix, which is at the bottom of the uterus, and we take some cells and we look for cervical cancer. We can absolutely prevent like 99% of cervical cancer if we all got HPV vaccinated. It has eradicated cervical cancer in some countries that have a very high rate of HPV vaccinations. So that's amazing. And in general, you need to get one by the time you're 21. In Europe, they let you wait until 25. It's just a question of how many people are you willing to die. In the United States, I think our threshold is 1 out of 100,000. But in exchange for saving that 99,9999 have to get a pap smear. You know what I mean? Whereas Europe, I think maybe their threshold's 5 out of 100,000. And that's why you can wait until 25 years old, that you'll miss 5 cases if you don't pap smear until 25. Those numbers are totally made up, but you get the kind of idea on that. I don't think it matters who does your pap smear, because the cool thing about the pap smear is it says inadequate cells. So if you didn't get the right sample, then they're like, you got to do it again. And so again, it's about volume. Like I had an internal medicine doc, she was like, and I was like, she's good and efficient. She probably does a lot of these. I'm totally fine with her. And then I'd say any OB-GYN should totally be able to do it. So it's just a question of, if your internal medicine person does it quick, does it confidently, then why find an OB-GYN, get into their office, wait 3 to 6 months to get into that office? Because again, the OB-GYN's like, pap smear, that's not like highly profitable, but delivering a baby is, or stuff like that. So they might be like, 3 to 6 months or whatever like that. And then in the future, I think we can just test for high risk HPV. So there's 160 different types of HPV.
Right.
And there's like 4 of them known to cause cancer and 4 of them known to cause warts. And we don't care so much of the warts, that's just convenience. And the only reason I'm bringing this up because the vaccine has, I believe, is an HPV 9. So it covers like the ones that cause cancer and the ones that cause warts. But if you don't have these high risk ones, then the risk of cancer is low. And so oftentimes we'll do a pap smear. If it's abnormal, we'll do a reflex HPV, because it used to cost more to do this HPV test. But as we do more HPV tests, hopefully this thing will be cheaper than our original pap smear. And then we can just do the high risk HPV, and you could even self do that. You stick a swab up, you swirl it around, and they're just looking for this bad HPV. And if they find it, then you got to go down the hole of doing all this stuff. But if they don't, then you're good to go.
That's awesome. So getting a pap smear is not only beneficial for yourself, but also maybe for others in the future.
Maybe. The key is really getting your HPV vaccine.
Oh, the vaccine. Gotcha.
Yeah.
That makes sense. And
not
then
so much the pap smear.
Is the HPV vaccine covered by insurance?
Yes. So it is covered. I haven't heard any insurance that doesn't cover it. The main thing with the HPV vaccine is, I believe the cutoff is 26, because they assume by 26 you've had enough partners to expose you to HPV that wouldn't be worth it necessarily to do it. But if I were, a widow and I'd been with the same person my entire life, and then at like 50 or older, I'm back in the game, I might consider getting the HPV vaccine because now I'm going to be back in the game and exposed to a ton of people.
Gotcha. Okay, that totally makes sense.
But if you were exposed under the age of 26, then, before your person died on you, then you don't need the vaccine at 50. But like I hooked up with my first, last, and only. And so if I, at older age, he were to die on me and I got back in the game, then I would be virginal-ish. And so would need protection.
Oh, no, that totally makes sense. I didn't know that. I honestly thought that you just have to get that. But you should still get it, but that's really interesting. Same with the COVID vaccine. If you haven't gotten that yet, get it. That is something that, protects yourself, but also protects others.
99% of those in the hospital with COVID are not vaccinated currently in the United States.
Or like only got one and didn't follow up or something like that.
Yes.
Either way, get both.
Get 2 vaccines, and if you got the J&J, they're suggesting get number 2 with the other one.
With one of the others, yeah, which makes sense. Better safe than sorry, for sure. I thought of one more thing, actually 2 more quick things to kind of go over. The first one is, I don't know if you know much about this, but just kind of out of my own curiosity, I'm signed up with One Medical, and I know a lot of people are signed up with that, and other similar healthcare providers, which basically, for anyone who doesn't know what that is, it's basically a single service that you pay for, and it's like an annual fee. I believe it's about $200 in most cases, and you get access to all the providers basically who are located within that or who work for that company. It's a little bit confusing, but I was wondering how you feel about that level of care versus going to just finding another specific doctor's office. I don't know if that made any sense, but I was just curious what you think about that, because I know a lot of people have been doing the One Medical thing, and I'm just curious how that is versus just going to one doctor's office.
So I think the way to think of One Medical is kind of like concierge medicine is what we call it in medicine, but cheaper. So concierge medicine is you pay like $1,000 or $10,000 a year, and all that money gets grouped together so that the doctor that's seeing you doesn't have to see as many patients, and then can give you more attention and more care. And One Medical is doing, a fraction of that, 1/10 of that, or 1/100th of that. And so their doctors don't have to see as many patients as normal, though $100 is not much, because theoretically we as physicians, I don't know what Stanford bills, but I did get a bill back in 1993 from a doctor without, coverage, blah, blah, blah. And it was $750 an hour. Oh. So $100 a year goes nowhere in the world of $750 an hour. But I do think One Medical is brilliant in that I feel they've kind of rebranded Kaiser. You don't pay Kaiser, but you get the Kaiser, but doesn't have the Kaiser stigma of Kaiser. Not that Kaiser's bad. I think it's a brilliant kind of public health working towards system. I love the fact that they're one system, they communicate each other, and there isn't difficulty to pass you on to their specialists and stuff. I don't know if One Medical has specialists. I'm pretty sure they only have primary care physicians.
Mostly PCPs, yeah.
And so to me, it's just a practice, and it's pretty, and it's, touchy-feely, and it's nice. It doesn't cost that much if it's $100 a year. But I'd look at the quality of the doctors. And I think sometimes the layperson doesn't know. And I'm not saying they have bad ones. I'm saying I just haven't looked. And maybe they've attracted all the good ones because they want a cushier life, or they want a prettier one, or I don't know. But their clinics are beautiful. And I do know people there. I think, full disclosure, I think my friend's like the head of some division there or something like that.
Awesome. Oh my goodness. No bias or anything. That's my experience so far. But I was just curious. Okay, that's good to know. So if you want to sign up for that, it's still, again, looking at the providers, but definitely doable. And that brings me to kind of my last question, which wraps everything up. I know you said you were mentioning this before, but what do you do if you dislike your provider, whether it's your PCP or your specialist? How should you go about that?
Yeah, I think, if you don't like your physician, you absolutely have the right to take your business elsewhere. What we were talking about on the previous one is, how do you choose your doctor? One might be to look at reviews, but I just want to say, take all reviews with a grain of salt. Yeah. Because particularly adolescent medicine or eating disorders or anorexia, the patient wants to lose as much weight as possible. And we're like, nah, your bones are going bad, your heart is going down, you're going to die. And so, do you think that patient's going to write me a good recommendation when I'm like, you can't play sports, you can't go to prom, you can't, graduate because you're going to starve yourself to death and I got to put you in the hospital? That's going to be an unhappy patient. Or we've had patients and they're like, I'm, 50 years old and I'm a smoker and I want my birth control pill. But like the medical recommendations is if you're 35 and a smoker, your risk of blood clot and dying from that is higher than the birth control. And so if I write that, I lose my license. And as you've heard, it's really hard to get through med school, residency, and fellowship. And to lose my license over one person who wants a birth control pill that is totally against the rules and everything that's been written in the world, I'm not willing to risk that. And so are they going to write me a nasty review on Yelp? Yes. And so we've had patients like dispute our doctor's fees because, but the point is you took the doctor's time and our time is like $750 an hour. You paid $20.
You
and
paid nothing. Yeah.
I looked at your history. I went back and forth with you a lot of stuff and we make it clear that what you're paying for the doctor's time. And if the doctor reviews it and writes a prescription or even has any thought on it, that's like, you got something, but then they dispute it and the insurance company marks us as bad and refunds them, blah, blah, blah. So it's just sorry to go downer on you.
No, it's really important to know that. Yeah. And it's also necessary to consider before you, a little bit unrelated, but before you write that review, knowing that like maybe that isn't everyone's experience. Like maybe you just had one bad day. We all have bad days. But as you're mentioning, like it's okay to not like the doctor. There's nothing wrong with that. You can always switch to someone new. I think it's probably better in that case because maybe it just wasn't a good fit. It's better to go to someone that you get along with. I feel like you'll tell them more. You'll be more honest and all that. It doesn't mean the other person's a bad doctor by any means. Maybe it's just they don't fit with what you need specifically. And I like what you were saying about like touchy-feely versus just like telling you how it is. And if you want one or the other, there's nothing wrong with that. It's just kind of how you react better to that type of advice. So
yes. And yeah, I mean, it's just some people are like in and out, just tell me what to do. Other people, like you got to coax them and stuff like that. And there's different practices that have different capabilities, like, at Stanford or an academic institution, because we have medical students and residents, they give us more time because the medical student resident can suck up some time. And so your new patient visit's an hour, a follow-up is a half an hour, but in other systems it's 15 minutes and 30 minutes. So that's like, you get double the amount of time. And then sometimes the negative of a medical student is they ask every question under the sun, but then the positive is they pick up weird stuff that nobody else would have picked up because they asked all the questions and your normal doctor's like, I got 15 minutes, I gotta get you out of here, that kind of thing. So everything has its positives and negatives, and it just depends which way you want to go. And as a physician, when I go in, I'm totally fine with medical students and residents because I know what it was like to be there. And if no one had ever let me do my first pelvic, then I would have never been able to do the thousands of pelvics afterwards. Right?
It's crazy. Yeah, no, that totally makes sense. And that's really good. It's just good to know like best practices with your doctor and also defending yourself being an advocate for yourself rather. And also speaking up if there is like malpractice that you notice and legitimate malpractice, not a doctor told you something you didn't want to hear, but maybe told you something that you really think could be dangerous or that you think was inappropriate or something like that, you can always report it. That's really also something like being an advocate for yourself. Of course, you want your doctor to advocate for you, but at the end of the day, you also have to do that for yourself because they're seeing so many different patients. It's just impossible for them to really be confident with every single person. So things to keep in mind, but things I've learned from not going to medical school, but having a lot of doctor family members. And Dr. Yen, of course. So that is pretty much it for this evening. Thank you to everyone who is not currently watching this, but hopefully watching this at a later date. If you have any questions, once again, feel free to leave them anytime. We will have one of our PCAs get back to you. In the meantime, feel free to sign up for an online doctor consultation. You can use the code down below. That is for cash patients only, just to be clear for that. But there's another code, Trendy. It's just the code Trendy. That one you'll get I think it's $15. And it's that one you don't have to be a cash patient only. So different ways for this. Other than that, follow us on social media. We'll be posting a bunch throughout this week. We have a couple new things this month going on, new campaigns, all that fun stuff. So be on the lookout. And other than that, we will be back in August unless something else comes up in the meantime. So have a lovely evening, everyone. Thank you so much. And we'll see you all soon. Bye.